Good morning. This is All India Radio, Kohima. The morning news are read by Jonas Yantan. First confirmed positive case of COVID-19 from Nagaland was reported after a man tested positive yesterday at Guwahati Medical College and Hospital GMCH. Nagaland Health Minister S. Pangyapom, in a tweet early this morning, said, "Unfortunately, one person from Dimapur has tested positive of COVID-19 and is under treatment at GMCH at Guwahati." He added that anyone who came in contact with the person will be immediately quarantined, and also certain locations will be sealed for general safety. Earlier, detection of Nagaland's first positive case of the COVID-19 was informed by Assam Health Minister Dr. Himanta Biswa Sarma last evening through Twitter. The Assam Health Minister in a tweet stated that the patient was referred from a private hospital in Dimapur to GMCH after he was found with symptoms of COVID-19. Dr. Sarma said the patient is undergoing treatment. The total confirmed cases of COVID-19 in the country has reached 9,211. Out of these, 1,086 have recovered, while 331 died. Joint Secretary in the Health Ministry, Love Agarwal, said the government is extra prepared in case of an exponential rise in COVID-19 cases. Agarwal said, based on the discussions at the level of Health Minister and Home Minister, work is being done on an urgent basis to expand capacity for COVID-19 testing in government and private medical colleges across the country. Joint Secretary in the Home Ministry, Punya Salila Srivastav, said the situation regarding essential commodities is under control. In the Home Ministry control room, officials of ministries of Civil Aviation, Consumer Affairs and Railways have been working in coordination with states to resolve logistical problems. She said states and union territories have again been informed that there is no restriction on interstate and intra-state cargo transportation, and they must ensure passes for employees of manufacturing units of essential commodities. Dr. Manoj Murhekar of Indian Council of Medical Research said in the last 5 days, on average, 15,747 samples were tested per day, and 584 of those were found positive per day. Meanwhile, the group of ministers has approved the release of hydroxychloroquine to 13 countries after an assessment of stocks. Nagaland government has issued a clarification stating that all schools, colleges, universities, all types of educational institutions, coaching and tuition classes, either government or private, shall continue to remain closed throughout the state till further order. An official bulletin said the clarification is issued to clear confusion arising out of the order to resume government offices. Earlier, the state government directed that the Nagaland Civil Secretariat and the directorates in Kohima and Dimapur and all government offices in the districts shall resume their functioning with skeletal staff from today. Union Minister of Consumer Affairs, Food and Public Distribution, Ram Vilas Paswan, said the government will deal strictly with black marketeers and hoarders. In an exclusive interview to DD News, Mr. Paswan said more than 30 lakh metric tons of food grains have been sent to states and union territories. He also said that during the lockdown announced to contain COVID-19, instructions have also been given to states to ensure food supply to all, including people without ration cards. The first COVID-19 patient of Manipur has been discharged from Jawaharlal Nehru Institute of Medical Sciences, JNIMS Hospital. The 23-year-old patient was tested positive of novel coronavirus on 24th March, and she had travel history from UK to Manipur. Speaking to AIR News, Director of JNIMS, Professor T.H. Pimmo, said the patient has not shown any symptoms of COVID-19 for last 11 days and found negative of the virus 3 times. He said the patient is physically fit now and having food properly. However, she will be in compulsory home quarantine for 14 days and abide the rules of quarantine. With that, we end the morning news. Have a nice day.